Welcome back in. Well, expecting mothers like myself spend a lot of time at the doctor and taking care of themselves, but preconception health care can be just as important. And Dr. Sarah Jaber is an OBGYN affiliated with Shelby Baptist Medical Center in Alabaster. Thank you so much for being here, doctor. And we're talking about preconception care. So obviously, why it's necessary. Talk about the idea of preconception health care.
Good morning, and thank you so much for having me here. So what is preconception counseling? Preconception counseling is the goal of preconception counseling is to maximize a woman's health prior to getting pregnant in order to reduce the risks for the mother as well as the baby during the pregnancy. So the big question is, why do we really care about it? Because 50% of pregnancies actually here in the United States are unintended, and therefore it's the doctor, basically the OBGYN, the role is not only to screen or identify women who are actively trying to get pregnant, but also to educate and assess the risks for other women who are capable of having a child. And what does that include? Basically, what we do is we look for untreated, undiagnosed, or even poorly controlled medical conditions that a patient might have. For example, a patient who's pre-diabetic. It's very important that her blood sugars are well controlled prior to trying to get pregnant, because it decreases the risk of anomalies and death of the baby. Other issues including tobacco smoking, other environmental exposures. We also look at immunization history. So all of these are what we look for during a preconception counseling visit, and that's why we urge our patients who are sexually active, trying or even not trying to get pregnant, to see their doctor and ask all these questions.
And this is geared towards reducing the risk of adverse health effects.
Exactly.
For the mom, for the baby.
For both the mom and the baby. So what we want to try to do is to optimize the health of the mother that is going into a pregnancy, so that the pregnancy can have less risks for both herself as well as the baby.
And I'm wondering too, for women, for couples who are trying, the preconception care, could that help increase the chances of getting pregnant? So
yes to your question, especially when a mom has an underlying condition that the preconception care will reveal it and will basically address it, and it will eventually help increase the chances of getting pregnant.
And also for the couples that are trying, but also you're saying for a couple that may not be trying, or a woman who may be pregnant at some point in the future.
Exactly.
You need to be healthy.
You need to be healthy in order to be able to go through pregnancy in a healthy way, and also to reduce any risks that can come during the pregnancy.
Okay. Well, great information, Dr. Jaber. And if anyone has any questions, can they contact you? Would you say, hey, contact your own doctor?
So, of course, I mean, we're always welcoming new patients at our practice at Shelby OBGYN, but this is the idea of preconception counseling, yes, has to be tailored to the OBGYN.
Gotcha. All right. Ask questions to your doctor. Thank you so much for being here.